Welcome back for another deep dive with Vet NeuroJar. Today we're really going deep on a case report that has everyone in the veterinary neurology world talking.
It's a fascinating case.
Oh, yeah.
It's a cat with X-linked muscular dystrophy. You probably know it as FXMD.
Right.
And what makes this case so interesting is that this cat had a much milder form of the disease
Okay.
and lived much longer than we usually see.
Much longer.
So it really challenges how we think about FXMD in cats.
Yeah, this is like upending everything we thought we knew about FXMD.
Absolutely.
And it's a case report straight from the Journal of Veterinary Internal Medicine.
Yes.
So you know it's going to be good.
Hot off the presses.
Oh, yeah.
Cutting edge stuff.
So before we jump into the nitty-gritty, can we just take a step back for a second? Like, just for anyone who might not be totally familiar with FXMD, can you give us a quick,
Sure. So FXMD, it stands for?
X-linked muscular dystrophy.
Yeah, exactly. X-linked muscular dystrophy.
Like Duchenne's.
Yeah. It's a genetic disorder that causes muscle weakness, and we often see hypertrophy too. And as you mentioned, it's really similar to what we see in humans with Duchenne and Becker muscular dystrophy.
So this case report focuses on a 9-year-old domestic shorthair.
Yep.
Who first started showing signs at 3 years old.
Right.
So pretty young.
Yeah, relatively young for sure.
And the signs that we're talking about here, they're pretty significant, right?
Yeah, we're talking muscle swelling that just wouldn't go away.
Oh, wow.
Difficulty breathing and a slow, abnormal gait.
Yeah, that's not your typical, oh, my cat's sleeping a lot today.
No, not at all. This is serious stuff.
Yeah, red flags all over the place.
Absolutely. And the blood work showed elevated muscle enzymes.
Which ones?
ALT, AST,
All the big ones.
and CK.
Okay.
These are all signs pointing to muscle damage, which makes sense when we're thinking about FXMD.
Yeah, so it seems like everything's adding up, right?
You'd think so, but the journey to a diagnosis wasn't actually all that straightforward. Initially, at 4 years old, they actually thought it was just muscle hypertrophy based on some imaging they did.
Okay.
But they couldn't figure out what was causing it.
So then they had to dig a little deeper.
Exactly. They performed an electromyography.
An EMG.
Yeah, an EMG.
Okay, and this is where things start to get really interesting.
It does.
Because the EMG revealed these unusual sounds.
Right. They were these pseudomyotonic discharges and complex repetitive discharges.
I can't even imagine what that would sound like.
Well, the report actually says they sound like a dive bomber.
What?
Yeah, like a dive bomber.
Wow. Okay, so I'm picturing like a World War II airplane.
Exactly.
Like noises coming from the muscles.
Pretty wild, right? And what these sounds tell us is that there's something wrong with the electrical activity in the muscles.
So like the way the muscle fibers are contracting and relaxing is off?
Exactly. It's a sign that something's messing with how the muscles are supposed to work.
Gotcha. Okay.
So to really confirm the FXMD diagnosis, they did a muscle biopsy. And what they saw under the microscope was classic FXMD.
Like textbook.
Yeah, textbook. We're talking muscle necrosis and regeneration, basically a cycle of damage and repair happening in the muscle tissue.
Oof, that's rough.
Yeah.
So they have this cat with a pretty clear clinical picture of FXMD.
Right.
They've done all the diagnostic workup.
Right.
But then...
This is where the real groundbreaking stuff comes in.
Okay, hit me with it.
They did whole genome sequencing, and what they found was a unique genetic variant in the dystrophin gene.
DMD.
You got it, the DMD gene.
And this gene is important because...
It's the same gene that's involved in human muscular dystrophies.
Oh, wow. So this finding in a cat...
It really highlights how connected animal and human health are.
Yeah, it's like looking at the same disease through different lenses.
Precisely.
So tell me more about this variant, this genetic variant that they found.
Sure. So it's what we call a nonsense mutation.
A nonsense mutation.
Yeah. And it's technically labeled as C.8333G greater than a semicolon P.TR TRP2778 day.
Oh, wow, that's a mouthful.
It is. But what it means is that a single letter in the DNA code is changed.
Just one little letter.
Yep. And that one tiny change creates a premature stop signal during protein production.
Oh, so like the instructions for making the protein are cut short?
Exactly. And that leads to a shortened, non-functional dystrophin protein.
And dystrophin is crucial for muscle cells, right?
It is. It's like the scaffolding that helps keep muscle cells strong and stable.
So without it, things start to fall apart.
Exactly. The muscle cells become weak and susceptible to damage.
And that explains the muscle weakness and all the other symptoms we see in FXMD.
Precisely. And here's the thing. Nonsense mutations like this one, we usually think of them causing a severe form of the disease, like what we see in humans with Duchenne muscular dystrophy.
Yeah, so this cat with this mutation, we would expect to see a much more severe presentation, right?
Exactly. But that's not what happened.
Right. This cat's case was surprisingly mild.
Very mild. And he lived way longer than expected.
So the big question is why?
Why, indeed. It's a real head-scratcher.
So how do we explain this unexpected outcome?
Well, researchers have a couple of theories. One possibility is alternative splicing.
Alternative splicing. Okay,
Yeah.
I've heard of that. But remind me.
Sure. So basically, even though the main genetic blueprint for dystrophin is messed up, the cat's body might have a backup plan.
Interesting.
Like a set of alternative instructions that allows it to make some functional dystrophin protein.
Ah, so even with this genetic hiccup, the body finds a way to compensate, at least partially.
Exactly. And that could explain why the disease was so mild.
It's amazing how resilient the body can be.
It really is. The other theory is that the truncated dystrophin protein, the shortened one, might still have some function.
So it's not completely useless.
Right. It might not be perfect, but it could still be providing some support to the muscle cells.
Okay, so that could also contribute to the milder disease course.
Exactly.
Now, the report mentions that they treated this cat with prednisolone,
Yes, a corticosteroid.
and he actually showed improvement in his breathing and the tongue swelling.
Right. And get this cat lived to be 11.8 years old. Wow.
Which is remarkable for a cat with FXMD.
Yeah, that's almost 4 years longer than when he first started showing signs.
Exactly.
That's really incredible. It shows that even with this diagnosis, there's potential for management and a good quality of life.
Absolutely. Now, this case also brings up some important points about anesthesia.
Yeah. Anesthesia can be tricky in these cats, right?
It can. We know that volatile anesthetics, the ones that are inhaled, can be really risky in cats with FXMD.
Because of malignant hyperthermia?
Exactly. Malignant hyperthermia. It's a life-threatening reaction where the muscle tissue basically starts to break down rapidly.
Yeah, it's a scary situation.
It is. But this case report highlights a safer alternative: total intravenous anesthesia, or TIVA.
Okay, Tiva.
Yep. The cat in this case had both the EMG and the muscle biopsy under TIVA, and everything went smoothly.
So that's really promising. It suggests that Tiva could be a much safer option for these patients.
Exactly. And this could have a big impact on how we approach anesthesia in cats with FXMD. Yet, this one case has really opened up a whole new avenue for managing this condition.
It really has.
But of course, with new discoveries come new questions.
Always. This case, with its unique genetic variant and the surprisingly mild presentation, raises a lot of questions.
So many questions.
It's like, how common is this variant in cats?
Yeah, good question.
Could it be explaining other mild cases of FXMD that we've seen?
That's what I was thinking. And like the biggest question of all, is this a whole new subtype of FXMD?
Right. Could this be a milder form of the disease that we just haven't recognized before?
Yeah, that's a game changer.
It is. This case could completely change how we think about FXMD.
How we diagnose it, how we treat it.
Exactly. And it really highlights the importance of genetic testing.
Especially for these unusual cases.
Absolutely. It's like we've been missing this piece of the puzzle.
And now things are starting to make more sense.
Right. And it really underscores the need for more research.
More genetic testing.
To figure out just how common this variant is in cats.
Yeah, because it could be the answer to so many questions.
It could be explaining all those milder FXMD cases that we've been seeing.
The ones that didn't quite fit the typical picture.
Exactly.
And if that's the case, it could change everything.
It could change how we talk to owners about this condition.
How we manage these patients long term.
Absolutely. It's really exciting to think about the possibilities.
Yeah, it's a reminder that even with a tough diagnosis, there's always hope.
Always. And there's always more to learn.
More to discover that could lead to better care for our patients.
Exactly. This case is a perfect example of that.
It shows the power of really digging deep and questioning what we think we know.
And who knows what other secrets are hidden in our patient's DNA just waiting to be uncovered.
That's a great question to leave everyone with. What other mysteries are out there just waiting for us to solve them?
Well, that's all the time we have for today.
But this conversation, it's really just the beginning.
It is.
We need to keep asking these questions, keep pushing the boundaries of what we know.
Absolutely. That's how we make progress.
So for all the vets listening out there, remember to stay curious, stay adaptable,
Keep an open mind.
and never stop learning.
Because there's always something new to discover in the world of veterinary neurology.
From Vet NeuroJar.
Yeah.
Keep those minds-inspired hearts light and tails wagging.